And that was awesome. So enjoyable. And that was awesome. So enjoyable. Okay. All right. Hi, everyone. I just finished that wonderful lecture ahead of us. Now you guys were going to talk a little bit more about some research. And that was awesome. And those kind of things. So enjoyable. Hi, I'm Karen West, and I want to thank you for coming to hear our presentation today. All right. Hi, everyone. Presentation is about I just finished that wonderful lecture ahead of us. Nursing Informatics research team. Now you guys were going to talk a little bit more about some research. And that was awesome. And those kind of things. It is a collaborative. So enjoyable. I'm Karen West, and I want to thank you for coming to hear our presentation. All right. Carolyn Sykes. Hi, everyone. And Dr. Presentation is about I just finished that wonderful lecture ahead of us. Nursing Informatics research team. Now you guys were going to talk a little bit more about some research. And that was awesome. And those kind of things. It is a collaborative. So enjoyable. I'm Karen West, and I want to thank you for coming to hear our presentation. All right. Carolyn Sykes. Hi, everyone. And Dr. Presentation is about I just finished that out here. Okay. There's some says that my voice is cutting out some. I did try to load some text for this, and you'll be seeing it in the chat as well. Okay, our agenda for this presentation today. We want to talk about issues impacting nursing education. Nursing education has definitely been in the news for quite a while. We know that we have several nurses that are getting ready to retire, which is going to make a deficit for nursing. So we need to increase the ones that are coming in. And we also want to increase our education we already have, encouraging them to do master's to doctorate level degrees. Chamberlin University, we want to talk briefly about how they're responding to the issues that are going on in nursing. AACN Master's Essentials, that's the American College Association Colleges of Nursing, and they set our quality standards, the master's degree in nursing. The ANA Nursing Informatics Specialist definition. ANA is the American Nurses Association, and the degree that Chamberlin University offers in the Master of Science of Nursing is a Nursing Informatics Specialist. Virtual Practicum for a Nursing Informatics Specialist. A specific research project that is comparing virtual practicum outcomes with on-the-ground practicum outcomes, and some challenges that we have faced as we have worked on this research. Objectives of this talk today is to discuss these challenges nursing students actually face in the higher educational environment, to identify virtual learning environments, how they can be used to support a Master of Science Nursing practicum requirements for graduation, understand that educational best practices can be applied in identified that a virtual practicum is actually a newer component, and identify challenges to our current research and how we plan to address it. Current issues in nursing. Right now, we have insufficient faculty. We have insufficient clinical sites. We have problems with classroom space and getting appropriate clinical preceptors. According to the AACN's report, 2016-2017 on enrollment and graduation in baccalaureate and graduate programs in nursing, U.S. nursing schools actually turned away 64,067 qualified applicants from baccalaureate and graduate nursing programs due to an insufficient number of faculty, clinical sites, classroom space, clinical preceptors, and budget constraints. So we have an issue with the fact that we're going to have a nursing shortage, but our educational system is not set up to handle the volume of students that are applying to come in. Master's and doctoral programs in nursing are not producing the students that we've got coming on. Efforts to expand the nurse educator population are frustrated by this. If you look at the basics to down, 9,757 qualified applicants for programs in 2016 and 2,000 qualified applicants were turned away from doctoral programs. So nursing and nursing education has some large issues ahead of them. We need to meet our need, but we have to be able to have the nurses on board in education to be able to meet that as well. Chamberlin University. So Chamberlin University is actually a very, very large university, and it has on the ground. It also expanded into online education for nursing to help meet that need for those nurses who can't travel to a regular on-the-ground facility, trying to continue to work and to meet their education. They're also very innovative and have expanded into the virtual environment, evaluating and looking to see how this can assist us to meet our students. When you look at the research that's been done on simulation and virtual learning, there's actually a landmark study of the National Council of State Boards of Nursing that explored replacing clinical hours with simulation. The study broke down in several groups, but actually 50 simulation. And in this particular study, the evaluation of it, the end of program knowledge, competency, and readiness for practice was no different among the students that were around, students that had simulation mixed in, even the level all the way up to 50 simulation. This was an undergraduate study, but what I liked about it is the fact that they went all the way through. They looked at end of program study. They looked at the NCLEX or state board pass rates for these. They followed these students into the work world and had their managers evaluate them. And all the new graduates had similar ratings in critical thinking, clinical competency, and overall readiness for practice. All evaluated measures were the same. So that's very promising for us as we look at how we meet the needs of the students trying to complete their education. A clinical practicum is something that's associated with nursing throughout each and every degree. And actually, what it does is facilitates the application of learned knowledge to actual practice, utilizing a preceptor or a mentor to support their knowledge and their role transition. When you look at a Master of Science in Nursing degree for nursing informatics, which is the degree that we're talking about, as you develop different components to meet educational needs, then you look at components such as this, which is quality, which is the associate, the AACN competencies. So you look at those as we bring them in to build them to develop. To look at their developing a virtual practicum type component. The degree, like I said, that we offer at Chamberlin University is the Informatics Nurse Specialist degree. And this degree is more associated with a clinical specialist. Upon graduation. The current definition of the Informatics Nurse Specialist by the American Nurses Association is that the INS assists nurses and other professionals in optimizing their information practice systems through project management and support their knowledge of information systems. The practicum component that we have built into the virtual learning environment focuses on those high-level standards from AACN and the project management utilization to build a graduate level project. In virtual learning, you can actively work on collaboration. It's a wonderful environment for mentoring, not only just from faculty, students. You can facilitate critical thinking. And in the virtual learning environment, the graduate project, just as well as it could be, and maybe in a virtual learning environment, we can take it a step further sometimes and develop prototype or show students what their project could actually look like. At this current time, we actually have 4 practicum components in our virtual learning environment. But our research is our focus of our specialty, which is nursing informatics or the INS student. And this is the actual question. That we've done on our IRB. We are currently under an IRB for this research at Chamberlin University, and the research will actually last for a year. So we're in the 1st, 2nd, 3rd, 4th, 5th, 6th, 7th, 8th, 9th, 10th, 11th, 12th, 13th, 14th, 15th, 16th, 17th, 18th, 19th, 20th, 21st, 22nd, 23rd, 24th, 25th, 26th, 27th, 28th, 29th, 30th, 31st, 32nd, 33rd, 34th, 35th, 36th, 37th, 38th, 39th, 40th, 41st, 42nd, 43rd, 44th, 45th, 46th, 47th, 48th, 49th, 50th, 51st, 52nd, 53rd, 54th, 55th, 56th, 57th, 58th, 59th, 60th, 61st, 62nd, 63rd, 64th, 65th, 66th, 67th, 68th, 69th, 70th, 71st, 72nd, 73rd, 74th, 75th, 76th, 77 Is there a difference in perceived competencies, perceived informatics competencies between students in a virtual practicum versus students in an on-the-ground practicum? The theory that we've applied to this particular research project is Benner's theory, novice to expert. Our methodology is quantitative, quasi-experimental, post-test only study. The instrument that we are utilizing is the adapted Nursing Informatics Competency Assessment called the NICA L3, L4. Our target population, there are 20 students admitted to each practicum session per course. Our current goal is to include 8 practicum sections to increase our target. This is actually an example of the Nursing Informatics Competency Assessment tool itself. The INS students, unlike other students, actually have a 16-week practicum associated with their degree, not an 8-week. This is a student self-assessment tool. It was developed initially by Dr. Toni Hebda, Dr. D. McGonigal, and Dr. Kathleen Hunter, and has been adapted, including Dr. Taryn Hill and Dr. Carolyn Sipes. The NICA L3, L4. L3 is a competent level of nursing informatics skills, which is where we would like for our graduates all to be once they complete their practicum experience. Their practicum experience is done in the course that it's right before their graduation level. And we want to see if nurses who are going through a practicum experience on the ground and our nurses who are going through the practicum experience in the virtual learning environment, how they're both doing by comparison on these level 3 skills. Level 3 is related to competent nurse. Our students use project management to solve actually a real-world informatics problem. So even though they're in a virtual learning environment, we're having them bring in an actual issue in healthcare, information systems, or electronic health records, or an issue that they could develop a project to help deal with that as well. This is the project management process that the students will go through, from design initiation all the way through evaluation. Everything is set up initially in those first 8 weeks, and then the second 8 weeks you do a go live experience or an implementation experience as they bring the project to life. These particular project management concepts are included in the ANA Nursing Informatics Scopes and Standards of Practice. Research. Research is utilized in education today in multiple directions, is it not? We use it to try to figure out quality. Are we meeting our goals? Is there something here that we're not identifying that needs to be? Research can be a quality initiative as well as an initiative to help identify change. Are we meeting where we need to be? And so we've already started this particular research project. And week 6 or 7, we email it out to the students that are working towards the end of their practicum and ask them to fill it out and send it back to us. What we have found this early, even in research, is that we're not getting a lot of participation. So we're actually getting an initial poor response. And we would really like to be able to utilize the research outcomes here, evaluate what we're doing virtually, how we want to change anything, and how things are done on the ground. One of the things that we looked at as far as that goes, as far as the NICA L3, L4, are also asked to complete this well. So we're kind of asking them to do something redundantly that they've already done. They're already very busy because they're working on a practicum component plus their school component plus, handling real life, and many are still. So we've done out for 2 semesters, and unfortunately at this particular so as a team, NERC came together to evaluate what do they feel like that we need to do. So we have sent in a request as an addendum. Go ahead and put L3. The students are actually already doing, asking them to continue to do it separately. We will have all the information anonymized before the team gets it so that we can evaluate it more effectively. The other thing that we have to deal with is the fact that the virtual component of the practicum is actually only utilized if an on-the-ground practicum cannot be developed for the student if they can't find it. So unfortunately we do have a smaller number of students that are actually practicum component, which also gives us a smaller number of students for comparison. But pulling the NICA L3, L4 for all students for 8 semesters should give a target area or target number that should give us some insight. We've had virtual practicum in this particular learning environment for several years. It has been ongoing since I was there in 2014. So we have a very developed programming component. But like anything else in education or healthcare or just dealing with technology, you always want to evaluate where you're at. How can you add? How can you change? How can you meet the student's needs better? The practicum component is such an important component for nursing education, for that last transition where they take all their education and begin to step into the role, begin to utilize what they've learned. That being able to give a student a good practicum experience is extremely important. In a virtual environment, you can tailor the experience a bit more, I believe, than you can in some on-the-ground environments to meet best practices. I have questions. Anyone?
Thank you, Karen. This is Toni Hebda. My apologies for not getting my proper virtual worlds tag on. I've been in faculty meetings. We're really excited to have our practicum experience. It's now been 6 years that we've used it for Chamberlin. And one of the limitations that we have are available mentors as well, in terms of we hold the same criteria as we would in a brick and mortar setting, that people need to be prepared at least at a master's degree level. And then, of course, we want them, in my case, I'm doctorally prepared. So we have to have someone who is willing and able to come into Second Life and meet all of the other criteria as well. We also would like to further build our environment to be more reflective of some real-world elements, including a well-developed electronic health record. Not that that's all that informatics nurses do, but many of our people go forth to implement or do training relative to electronic health records. And because we have limitations on the mentors, we have, as Karen mentioned, a handful of students in Second Life each session. I thought I heard someone typing. Of any CEUs available through Second Life. Specific to nursing, I take it? Not offhand, although that's something that we would love to do. Nursing or counseling? No, I do not. There is a group that has to do with education, a listserv. Perhaps someone else in the group is familiar with an offering of CEUs. Erin, you haven't come across anything for CEUs via Second Life in nursing or counseling, have you?
I have not. Toni, there was in chat that they asked, are you actively looking for SL experienced nurses who are willing to serve as mentors?
If they have the informatics criteria, or we also have executive track. And we also have a few healthcare policy people and educators. So yes, if you fit that bill, we would like to hear from you. So you can use Karen's contact information or mine at the end of the slides, and we'd be happy to talk with you further. Thank you for asking. Well, this group, I'm sorry.
I have to apologize about my avatar. When I talk, guys, y'all probably do too. I move my hands, I move my everything, so it's almost normal for me to move my avatar. Sorry if it was distracting.
Do we have additional questions? We're excited to be here with you today and excited by the conference, and very appreciative to the volunteers and organizers. And thank you for all coming. Okay, you're not a nurse but very interested in our study. Well, it's very preliminary. I can't talk. It's preliminary at this point in time, but we would be happy to talk further. So again, reach out and contact us further. As Karen noted, one problem that we have with our current research design that we're asking to have an amendment for is that we have our students self-assess their informatics competency as they enter the nursing informatics track and also as they are exiting. So our invitation to participate in the study was a second self-assessment, and in a busy lifestyle, that doesn't always fit. I don't know about everyone here, but oftentimes I have good intentions of answering someone's survey or following up, and then time is our enemy. Oh, great. Super. We'd like to hear and talk to further people.
To answer your question, I can't give you a specific major difference because we are in an interim. Okay, so we do not have all the final information that we can evaluate at this point in time to get study results. So we've got 6 more semesters.
Well, just to give you an idea of how small our numbers are, this is, I think, the second cohort that we have invited people to participate. It will be upcoming to the third cohort. And we wanted to keep the responses anonymous and evaluate them at the end. I think we had one response at the end of the first session, and this last session we had maybe 3 or 4 that I'm aware of. Karen, do you know if there were more people?
We've had 6 total responses. We had 5 from the second cohort and 1 from the first.
So certainly too small to be statistically significant. Anecdotally, the students love Second Life as a practicum experience. As they come into it, they're very anxious. For the informatics practicum, instead of having a scripted scenario, our executive track students have a scripted scenario where they develop a cardiac rehab unit, including budgeting facets and staffing and so forth, and equipping it. Whereas with the informatics students, Karen alluded to the fact that they do a variety of projects. So just to give you a few ideas, we have had students who have done gap analysis on real-world assessments, and they've brought it into Second Life by talking with their colleagues and using the expertise within the other practicum students. We have had students that have done a workflow and requested a simulation to be designed. We have a smart sink simulation of late. We have a telesitter simulation. We have had students that have captured various elements of telehealth and monitoring and requested that that be translated into a simulation within the Second Life experience. There are a number of other projects that have been completed in the past, some of which are not currently open for all to explore. We would like to make it a more robust environment, so we continue to build.
Agreed. And the wonderful thing is projects are nurse-led. They're brought into Second Life. It's possible for us to do it at all with that particular develop it. Then they present it and have other students in the environment come in and utilize it and give it back. So it's a wonderful testing type environment to bring a project in to develop.
Thank you. And we do have one of our current informatics practicum students in the audience. She's in the planning phase of her project management right now. We very much like to have it tied, their projects tied to personal interest and learning goals. Oh, okay, certainly. Thank you.
Yeah, please forward us questions if you have any at all. We would love to share.
Out of curiosity, do we have nurses with us today or other healthcare professionals? Oh, super. Great.
Great.
And what administration, not clinical. Okay. Respiratory therapy, in administration, that's great. Retired. Does one ever retire?
Yeah. Oh, nurses. You don't see too many of us that actually retire.
Counselor. Well, again, I don't think you ever get to fully retire. You may not be on anybody's payroll any longer, but...
No, but you bring lots of value to those that are currently learning in the profession, and the profession's always changing. So stay involved. Stay involved. Thank you, everyone, for coming.